Hi everybody, my name is Ben Fung and welcome to my vlog. This episode is brought to you by request from Ryan Michael Smith, and he wanted a kind of a quick blip about how we can approach patients and maybe some examples in decreasing fear and uplifting expectations in clinical outcomes. This spawned from Twitter. The tweet read something like this: low fear avoidance plus high expectations of positive outcomes leads to the best results. So today we're going to talk about talking patience and talking patience. Okay, so when it comes to the interactions between a provider and a patient, I find that the how is a lot more important than the what. Because the what will basically remain the same. There'll be a diagnosis, there'll be a prognosis, and there'll be an interventive plan. The way you decrease fear and the way you improve expectations is you have to build trust and you have to build confidence. Perhaps the most important thing is to let your patient express their totality of concerns. It's all emotional, right? It's a human experience when it comes to any kind of pain, surgery, injury, chronic conditions. It's emotional, really. There are some physical aspects to it, but most of the people that only have that physical concern, they carry themselves out of that problem. It's a lot of this nurturing that we need to do in order to decrease fear and improve their expectations. After you've heard out all their concerns, they're probably going to be pretty emotional even if they're not expressing it. But you need to take in that emotional content and bring it back to them so that they know you're taking that in. You're connecting with them as a human being. Once you do that, let them know what some real expectations are and some time frames. Those are very powerful. Give them a confidence interval. It doesn't have to be like exactly 3 weeks from now, bing, you're going to feel better. Right? It's not like that, but maybe 3 to 6 weeks, right? 6 to 8 weeks. There are certain things that occur in the brain, in the nervous system, in the body that's going to help you improve and feel better about your body, your condition, your diagnosis, your impairment. Whatever you want to call it, that other people have already pre-labeled it, you can start to use that over the course of your sessions to morph it into something positive. What might have been a condition or a diagnosis, you can call it, this is your functional limitation, or this is the sensitivity region or area of sensitivity, or this is the motion of concern. This is the area where the red flag in your brain is going off. It just doesn't want to go there. We need to retrain that brain because your tissue is healed. It's time to heal the nervous system too. So those are a couple of ways. Small steps, small goals, little tiny markers that allows a patient to see they are improving. On the get-go though, sometimes you can't turn that conversation right around. They may have it fixed in their heads that my back is out of alignment, or my knees are shredded to pieces, right? Worst cartilage I've ever seen, that kind of stuff. It's not your job to change their mind then. It's your job to build trust. Trust decreases fear. And little tiny goals being met, that boosts confidence and that elevates the expectations. There are so many different ways to elevate the clinical expectation and decrease the fear of your patients and your clients. But the most important part is you need to connect with them as a human being. So whatever that is, make sure that you're not stuck on the science, because the science isn't going to change, but the person will. So you have to change with that person. You have to be able to link with them, not as their provider per se, maybe as their friend. And maybe that's the difference they need. They needed somebody not to take a look at them as some type of scientific enigma. They needed them to feel like somebody cares. And that's where I feel that the best results occur, is when providers interact with patients as people. So those are my tips for talking patience and talking patience, because it requires patience on your side as the provider. So I'm looking forward to your feedback and any kind of future suggestions you have or requests for blog/vlog. You can tweet me at Dr. Ben Fung or email me at contact@drbenfung.com. So I'm hoping maybe there's time for one more binge filming event I can do today, and we'll have kind of a 3-part episode of the second block of the vlog. So yeah, that's it for now. I'm Ben Fung, and until next time, I remain yours in service. Have a great day.